Now at 6, a Volusia County family left scrambling after their loved one is suddenly dropped from hospice care. News 6 investigator Lewis Bolden found this can happen and what you can do if it does happen to you.
You know what, Matt, let me tell you, my sister was in hospice care for just 2 days before she passed away. So hospice stints can vary greatly. To qualify for hospice, you need to have a life expectancy of 6 months or less. But for dementia patients, the prognosis isn't as predictable. Hospice can be extended as long as the patient continues to meet Medicare requirements. Those requirements are also why the woman we're about to introduce you to is losing her coverage.
Because you're so beautiful.
A dementia diagnosis can't break the bond between Amy Yates and her 91-year-old grandmother.
The experience overall has been a roller coaster, but hospice care has really been such a big support system for caring for her.
Her grandmother has been in hospice care for the past 2 years.
She can't leave the house anymore to go to doctor's appointments. It gives us access to CNA care so we can bathe her, all of her equipment, her hospital bed, her oxygen machine.
That help would soon go away after Yates received this notice saying in 24 hours Medicare coverage for her grandmother's hospice services will end because Medicare will no longer pay. And the deadline to appeal the decision was also the next day. What do you think this is about?
I think it's she hasn't died fast enough, and it's costing them money that they don't want to spend.
Amy's family is dealing with what Medicare calls live discharge, and they're not alone. The Hospice Foundation of America tells me in 2022, 17% of people admitted to hospice care were later discharged, and about 6% of the cases were discharged because they no longer met Medicare requirements. Have you ever seen this happen before?
I have.
Jen Brown has worked in healthcare for more than 20 years.
If a person in their disease process, there hasn't been any kind of improvement or decline, if they're kind of at a steady plateau, there's really no reason to keep them on services because Medicare won't pay for that.
Even a plateau? Okay.
Even a plateau in condition.
Gotcha.
Yeah, over a period of time.
Brown owns a company where she helps seniors and families find independent and assisted living as well as memory care facilities. Brown says once people like Amy's grandmother are admitted into hospice, they are reevaluated every 60 days. The company is saying that a doctor evaluated her, but she's like, they're
Nobody
like, how?
came in
Nobody's
to do
come
that.
to the house.
That's the case in most circumstances. The doctor doesn't actually see the patient. A lot of times they do team collaboration and they talk to the nurses and the aides and the social worker. So they kind of do a case conference per se.
We reached out to Medicare about the Yates' case. A spokesperson tells us if anyone needs help or has concerns about their benefits, they should call 1-800-MEDICARE and ask to speak with a beneficiary ombudsman.
Dementia patients deserve dignity, not discharge. They cannot fight for themselves.
Yates appealed the decision, but she lost the appeal. However, her grandmother just got admitted to a new facility. As you can imagine, it is a tough adjustment for the family and the patient to go through this. It's why Amy has started a Facebook resource group for other caregivers, and I posted that information inside this story on clickorlando.com. But Matt, it is a tough situation when this happens.
Yeah, and I'm glad you're talking about it because it's not something that you hear about enough. For anybody who has a loved one in hospice, I've had it several times in my life. Once you get to a certain age, it just happens.
Right.
Is there anything they can do to avoid a situation like this?
Actually, there are a few things that people can do. Number one, you can talk to the hospice team about your loved one's progress. Ask them for an assessment of your family member. Does it look like they're at a plateau, or does it look like they're going to meet the requirements to continue on hospice services? And this way, you won't be surprised at the company's decision. So ask questions in advance.
I never knew you could come off hospice until it happened to my grandfather, so it was kind of a crazy situation.
I didn't learn until doing this report.
Yeah, and the percentage higher than you would expect. Lewis Bolden, thank you very much.